We can usually determine the cause and severity of the urinary incontinence in men just based on the history alone. For example, a man who's had a history of a prostate removal surgery is much more likely to have a stress incontinence, and we simply ask the patient when they leak. Is it when they cough and sneeze, or is it when they get an urge to void? And in terms of the severity, we typically just ask them how many pads per day they're using. If we want to have a little bit more of an objective measure of the severity of incontinence, we often do a standing cough test, which basically just has the patient stand up and cough 3 times and just assess the degree of leakage with that. It has to be done with a relatively full bladder. If the patient just urinated, they're not going to leak. But that tells us, first of all, if it's stress incontinence or if not. If it's urge incontinence, they won't leak with coughing. And if it is stress incontinence, that gives us a grading scale of how severe the incontinence is. There is a test called a 24-hour pad weight, where a patient would collect all of their wet pads over a 24-hour period, and we can weigh them against the weight of dry pads and determine the volume of leakage. It gives a more objective measure of the severity, but that's quite burdensome and we almost never do that. There's additional testing that's a little bit more invasive called urodynamics that involves putting catheters in and allows us to measure the volumes and pressures in the bladder as the bladder fills and empties, and gives us a lot better assessment, but we rarely actually need to do that unless it's a very complicated history. Another test that we do sometimes is a simple cystoscopy, which is a small camera that goes up the urethra to look at the bladder, the prostate, and also the urinary sphincter. That gives us a good sense of the anatomy, and while we're there, we can tell the patient to bear down and try to close the sphincter, and we can assess how well the sphincter closes. And if it doesn't close very well, then that gives us our answer that this is severe stress incontinence. So there's a whole bunch of tests that we can do to better characterize the incontinence, but we rarely actually need to do any of those tests. We can most of the time figure it out just based on history and physical exam alone.